Michael Diana, Behavioral Neuroscience, Chapter 8, Segment 4. Pain can last long after the injury that gave it rise is healed. The phantom limb pain is chronic pain that comes from missing an arm or a leg. Visual stimuli can help amputees reinterpret this pain to get rid of it. Neuropathic pain is pain caused by damage to the peripheral nerves. This pain is very hard to treat. It seems to be caused by an inappropriate signaling of pain nerves. The nervous system seems to have an amplified pain response. This occurs in the cortex, and some pain can be in the spinal cord as well. Microglial cells surround the synapse between the pain fibers and the neurons in the dorsal horn of the spinal cord. This makes the dorsal horn hyperexcitable or more active. Pain can cause gray matter to shrink, which is the equivalent of 10 to 20 years of normal aging. The cingulate cortex is much more activated if people are led to believe that the stimulus they're encountering will be painful. This can be experienced in illusory pain as well. The anterior and the posterior cerebral cingulate are activated. The anterior cerebral cingulate is believed to be the emotional component of pain. Migraines are intense headaches that are typically perceived from one half of the head that recur regularly and can be difficult to treat. They are thought to be caused by a wave of neuronal hyperexcitation that spreads across the cortex. Pain can be difficult to control. There are multiple strategies for alleviating pain, the first one being opiate drugs. Opiate has been used for analgesia. Analgesia is the loss of pain sensation. An opiate is a class of compounds that exert an effect like opium. Opioids are a class of peptides produced in various regions of the brain that bind to opioid receptors and act like opioids. There are three classes of endogenous opioids: endorphins, enalkphins, and dynorphins. Opioid receptors are receptors that respond to exogenous and endogenous opioids. The mu receptor also is known as the morphine receptor. Analgesia is more effective in men than women, and in the kappa receptor, the analgesia is more effective in women than in men. This is especially true for redheaded women. The periaqueductal gray is the neuronal body-rich region of the midbrain surrounding the cerebral aqueduct that connects the third and fourth ventricles, which are involved in pain perception. Injections into the periaqueducal gray relieves pain. Side effects of injections include confusion, drowsiness, vomiting, constipation, depression of the respiratory system. An epidural injection is an injection that is just outside the spinal cord's dura mater. An intrathecal injection is an injection to the dura mater and the spinal cord directly. Injections are prescribed infrequently and at low doses, and the brainstem is sometimes believed to control pain transmission in the spinal cord. Marijuana is smoked in a cigarette for a psychoactive effect. The second situation for alleviating pain is a stimulation of skin, and that is a transcutaneous electrical nerve stimulation, which is delivery of electrical pulses through electrodes attached to the skin, which excites nerves that supply the region to which the pain is referred. This can suppress certain types of pain, and as stimulating nerves around the source of pain provides reliefs, and it produces a sense of tingling, and naloxone helps to block the analgesic reaction. Placebos are substances given to a patient known to be ineffective or inert, but that sometimes bring relief. Opioids and placebos activate the same brain regions, and both reduce neuronal regions of pain. Acupuncture is the insertion of needles at designated points on the skin to alleviate pain or neurological malfunction, and pain is mediated by the release of endorphins. The final way of alleviating pain is stress, which is the brain systems produce analgesia when the pain threatens to overwhelm effective coping mechanisms. The cutting edge. There are two parts of pain, one being the specific sensation of damage somewhere in the body, and two, emotional upset that accompanies the sensation, and social rejection can do this as well.